my door. Knock, knock, knock.
Sorry.
I have checked my orders. There is an order for a PICC line dressing change. I'm going to come into the room. I'm going to identify my patient. I'm going to close the door for privacy. I've done my hand hygiene. I'm going to put on some gloves. And what I'm going to do is, the first thing I'm going to do, I want to keep this covered as much as possible. So I'm going to ask my patient, I'm going to explain to him what I'm doing. You know, I don't even know if this is on here, but I'm going to explain what I'm doing. I'm going to ask them if they're comfortable, if they're in any pain or anything like that. And then I'm going to tell them I'm going to change this dressing. So what I need to do is I need to have my patient, because guys, it's not enough to have them turn their head. You really do need to, and this is my kit, but I need the mask out of here. So you need to put a mask on your patient, because they always want to look at it, right? They want to look back. So put your mask on your patient, have them turn their head, because they're inevitably going to turn around and look at it. And I know it's their own germs, but you still don't want it there. So what you're going to want to do, and I don't know how it is on your CCE, what I always do is I always take this off, almost off, okay? So holding the skin taut so that you're not ripping their skin off. You want to bring it all the way, working from the outer edge in. You want to bring this almost off, right? Almost off, but not all the way off right now. Or if you wanted to go ahead and take it off, you're going to have to make sure that you hurry and do this step. So if we take it all the way off, it's going to be open to air, right? You're going to want to hold this with your finger, because you don't want to pull it out. I promise you. You're going to have one ticked off PICC line nurse and one very ticked off physician if you pull this out. Okay, so I'm gonna keep that. So please don't look at this. And I always put my patients, I always put their thing up on a pillow. You're going to cover anything that's, you know, you can, with their gowns, you can just open it, right? So now I'm going to take this off. I'm going to do hand hygiene again. I'm going to open my sterile kit. I want my stuff to be waist high and my patient to be waist high. So I'm going to pull this away from me. So I'm going to go ahead and put on, because this is kind of open, so I want to do this pretty quick. I'm going to put on my sterile gloves. And they're stuck together. Okay, I'd have to go get a new glove. So what you're going to want to do then is you're going to take this out, open it up. Remember, I have pterodactyl arms, so I'm just going to like toss it. And I'm going to clean from outside in. But if you go under this at all, I suggest you don't. You're going to clean in a circular motion all the way around. And I would call it like a half moon. Seriously, because if you go up under there, you're liable to knock it out, right? So you're going to toss this. You next grab this, you break its neck or wings or whatever you do with it. Now, you can leave this stat lock on there, which will hold it in place a little bit longer. Don't, without touching your insertion site, I know this is there and it's going to keep it from coming down some, but I always anchor it just a little bit. But I'm not touching my insertion site, right? So if I touch this, is this hand sterile now? It's the same y'all just did. It's not. But you're going to go. And around the area. Then what I do is I take this without pulling it out, and I go all the way down my stuff, and I wait. Now, the next, oh, I don't have one. Okay, now I'm not sterile anymore, but let's pretend this was in my pack, because I don't have one actually on there. I want to get this covered as quick as I can, but the first thing I want to do is get my bio patch back on. This bio patch, blue on one side, white on the other. So you're going to want to make sure, because I've touched everything with this hand, so I wouldn't want to touch my bio patch again. But you can split it with one hand, right? There's no right or wrong to this. I prefer to put my bio patch with the split down, because the next person who pulls it off doesn't have that much trouble. Does that make sense? So I do it like that, so that way, for the sake of showing you, you can pull it off without it pulling the pick, right? So open it up with your fingers like this. It's blue side to the sky. Put it on. Then you're going to want to get this covered as quick as possible. Quit looking at it. Because they do that. Make sure, guys, that when you put this on, that you pretty much put this in the center. Of course, you're going to want it to dry. Make sure that your window's in the center, but make sure you do not cover this thing. A lot of nurses do when we used to all do them, and you go in to change it, and this would be under there, and it was just a big mess. It was hard to do. So with this one, you're going to pull this off. Oh, the skin prep that comes in your package, this Sure Prep, if you use this on your patient, and if it's on your CCE, keep this away from, and you're not really going to use it on the mannequins, so we forget to do it. But if you really use it on a patient, make sure you keep this away from your insertion site. All you're going to do is you're going to go make a window with it. You're not going to go all around it. You just want to make a window, okay, with the skin prep. So at this point, you know what? You are done and did, and you can take your mask off. Your patient can take their mask off because it's covered at this point. It really is. So you can tell your patient, they can look at it now and all that. So then you'll put your little sticker here, and you put your date and time. And y'all need to really practice taking this off with gloves, because when you get into the real world and you try to do it, if you're not used to doing it with gloves, because everything sticks to your gloves. So now I want to change. Let's say I don't have another stat lock. So if I'm just going to change this stat lock, what you do is you're going to pull up on your little wings, and you're going to pull. It pops right off of there. You're going to just hold it up very gently and gingerly, pull this off, put another one back on, and then it just pops right down on there. You have two little blue things, and it should just fit right down in there, and it's not. Slide it around until it does. Pop these on. Your all's kits may have the ones that have the little butterfly things that you pull out. So make sure that you are looking at whatever you're going to have, because your alls may have a little butterfly rubber thing that pulls out and it just slops right on there. So for your caps, what you're going to want to do, these are, of course, your little green caps come in a little box, and you just grab you some, and they're not open like this. They've got a little piece that a little tab you have to pull off. These, let me show you something. These are in a package. Best way to do these is to, depending on how you can't put this on somebody, right? Because it's got air in it. So let's pretend this is saline, right? These are packaged wrong. They literally should be like that, because what you do is you open this up and you got your saline, and you can just flush a little saline in it, and just lay it down still in the pack and have it ready to go.
So are those sterile in the packet? Okay.
So you take this, you make sure it's clamped, because if you don't, you're gonna get blood all over you and all over your pillow. So make sure it's clamped, hold it up. You're gonna take your little alcohol swab and swab for how long? 30 seconds. And then you're gonna take the one that you've got, and they say that even though this is sterile, you're still supposed to scrub it. Even though it's sterile, right? You're supposed to scrub both sides of these, even though it's sterile. So you scrub, put it on, flush just a hair, make sure you get some blood return. You'll see some blood come up here, and then you just push it in. And then you wanna make sure it's locked. And you'll put your little scrub, 30 seconds. Open this and put it on. Do the same thing with the other one. I was with a student in, okay, so now let's finish this before I tell a story. Okay, so we're done with this. You feel okay? Is that okay? You know, you've done both of them. You're finished. And you take his arm off the pillow and everything, and you make sure he's comfortable. Put the bed down low and locked. Reassess. Oh, you know what I forgot to do? Is like when you first start this, you want to say on your CCEs, because I mean, obviously I've looked at it, right? As a nurse. When you do this for CCEs, you'll say, before you take this off, you know how we got it just about and we had it pulled down, you'll say, I'm assessing my insertion site, you know, through the thing. I don't see any redness, streaking, anything like that. It looks good. So you'll say that, you'll just verbalize that, okay? So now you've got him all situated. You have, if there was something hooked to it, you'll unpause it, put it on, and start your pump back. If there's not anything, then you put these little green caps on it. If there's something running when you come in to do the dressing change, obviously you pause it. And if you have a brand new PICC line, if the PICC team, let's say you have one IV and you have got 8 medications running, no joke, it can happen, and you're like, I gotta have a PICC line. I need at least a double, if not a triple or a quad. I loved quads myself, but so you tell them you gotta have a PICC line. So they call the PICC team comes. Well, you've had that medication running. Don't stop it in the IV until you get your chest x-ray back, because they'll do a chest x-ray, make sure that this is where it's supposed to be, right? So when you stop that medication, you better have, if it's a vasoactive drug, you better have another one hanging ready to go. You cannot take an IV from a venous peripheral line, the same tubing, same bag and everything, and just hook it to your new PICC line. Against the law. Can't do that. You have to get all new, you have to get a new bag of whatever you're running, and you have to get a new line. Okay? That's a must, because it's to cut down on the central line infections. So we've done this, we're ready, we've hooked him back up, and because we just did a dressing change, so he's ready to go. I'm gonna clean up my mess here, and I'm going to ask him if he's comfortable. I'm going to pull off my PPE. I'm going to wash my hands. I'm gonna do hand hygiene, and I'm going to leave the room, and I'm going to document it. I'm gonna chart it.